Hi, loud and clear. Very good. How are you
Cool.
doing, doctor?
Great. Really looking forward to having this chat with you.
Okay, terrific. So, guys, my pleasure and deep honor to introduce my guest today on House of Experts. As you guys know, we started this series, House of Experts, to bring to you experts from various domains so you can learn from the journeys of successful people and draw some inspiration from their lives. I'm going to be your host today. My name is Vibha Kagzi, and I'm the founder and chief education officer at reachiv.com. My guest today is someone who has really built her expertise and, as they say, gotten her hands dirty in the business of producing babies. So she started off as a medical practitioner, did her training here in Mumbai, and then followed it up with extensive training in the United Kingdom. She's going to touch a little bit about that. She has to her credit 3,000 babies. So get that right, 3,000 babies delivered. I wouldn't say single-handedly because I know there would obviously be a supporting team, but 3,000 babies, Rajalaxmi, to your credit. She was also voted Best IVF Consultant by the Economic Times in 2017 and Times Power Woman in 2018. In addition to all her fabulous accolades, having known Rajalaxmi personally, she is a terrific human being, and on the lighter side has a great sense of humor and is a wonderful mother to her daughter. So, Rajalaxmi, thank you for accepting the invitation to be on the show today.
Thank you so much for having me here.
Oh,
Really looking forward to this.
okay, terrific. So, jumping right into this. So, Rajalaxmi, my favorite question, I always ask people since, I run an education organization is to flashback into your early life and talk a little bit about, your early years and what were you like as a kid?
I was hell to deal with, and my mother will completely testify to that. So, people would think that as a doctor, I would have been really studious and I would do things when they were told at the right time and stuff. That was not happening. I was really interested in my Star Treks and my comics and stuff. And my mom really had to sit me down. Okay, exams in 20 days, so kindly please sit down and study now. So that is how I remember my entire childhood to be. And if you ask me, when did I get grounded down? I think the first grounding happened when I realized somewhere inside that I did want to become a doctor. And I also realized that becoming a doctor was going to be a lot of hard work. And that's where I think I sort of, stopped being the procrastinating kid that I was and started getting a little more serious about my studies.
Okay, so you're saying grew up naughty, bratty, not into academics. So
Absolutely.
what drew you to medicine? You come from a family of doctors. What is the family background
Yeah,
like?
so both my parents do hold a medical degree,
Okay,
but both of them are not practicing doctors. So,
okay,
I was never exposed to the typical, doctor's family environment. But you also met Anaka, my younger sister. So when Anaka was a baby, we have quite a bit of gap between us. And to be able to manage two kids and the household and stuff, my mom basically decided let us shift to JJ Hospital doctor's quarters,
okay.
so that it'll be easy to manage things. And as a kid in her sixth and seventh standard, I actually saw all these medical students with their white coats and these lovely stethoscopes around their head, around their necks, and they looked so smart. And I thought, oh my God, this is like really good. So the glamour
Oh,
got into me at that point of time, and I thought, yeah, it really looks good to be a doctor, and this is the way I'm going. And that is where I actually started thinking about medicine seriously.
okay,
And somewhere around my ninth standard, I sort of buckled down and I thought, no, this is the time I sort of start putting in efforts in. So
okay.
yeah,
So you
that's the
did
moment
grow
it
up in
happened.
that environment. You had the good
Yes,
fortune of having parents from the background, having
Yes.
stayed in an hospital environment. So, so you had those early sort of, leanings into this
Yes.
field. Okay, great. What happened then? So you weren't a good student. Obviously, we all know how cutthroat medicine is, and especially in India, the
Absolutely.
number of seats are very, very few. So how did you make that transition? And at what stage does this, I know that an MBBS is a general degree. So, tell us about that phase, and then how did that sort of turn into fertility, which is such a like a very, very deep specialization?
So MBS, entry into MBBS itself was not easy. Basically, I had my dad telling me from very early on, the life of a doctor is not easy. Do you like really want to go down medicine? You like having fun in life, and this is going to be hard work. So I had like everybody telling this teenager not to get into medicine, and I thought if everybody is saying a no, I'm doing that.
So the
So
reverse psychology
yeah.
worked on you, huh?
Absolutely. And then getting into medicine, obviously, as you know, was tough because when I got in, the seats were few. We did not have as many medical colleges available. And as luck might have it, I ended up being first on waiting list for government hospital. And I was getting into, from various entrances. I was getting into the north, I was getting into the south, and the family decided she's not mature enough, she's young, we're not sending her off at the age of 17, 18 to some like strange city. And I, funnily enough, took up electronics engineering.
Oh, wow. Okay.
And I did that for one whole semester. I have passed my semester. And then luckily, Teda Medical College opened up as a new college in December.
Okay.
And because I was first on waiting list for the All Maharashtra, waiting, I was the first person through the government or admission to get in there. So that's how medicine happened. So there was a bit of a wait before even medicine got through.
I see. Okay. So you went to engineering and then you sort of found your way back to
Yes,
medicine. Okay. And
absolutely.
I have a question here from Sanjeev who says, Dr. Ma'am, could you tell us about your medical journey in college? So flashback to the MBBS. What is it like for some of us who haven't been through that? What is this whole MBBS hype about?
It was absolute fun and it was absolute hard work.
Okay.
Fun because I completely loved what I was doing. Start of first MBBS, and I fell in love with every subject that I was being taught, and I actually found my niche. So, until then, becoming a doctor was a dream. But when I actually started learning those subjects, I knew that I had an aptitude for it, and I was good at it too. So, a lot of things, I just like understood the logic of it so easily. And therefore, the 5 years of MBBS were a thorough party for me. And having said that, all through the 5.5 years, I have been to only two parties. So
Oh, wow.
people
Okay.
look at the glamour of the field, and people see that as a doctor, once you settle, the earning potential tends to be good and all those things. But basically, it's not so. It is a lot of hard work, and if you decide to become a doctor, you need to be able to buckle down and give up on a lot of fun parties and outings, and you have to your like hobbies take a back seat and all those things.
Okay.
So,
So you're saying it comes at a
yeah,
cost.
yes, it does.
And I love that you phrased it like a big party, even though you didn't actually attend any. So for you, just the sheer joy of being in that environment and studying and
Yes.
learning seems to have already culminated into being a party.
Yeah.
Okay. So,
Yeah.
okay, clearly a lot of passion coming through there, doctor, because obviously this is not everyone's cup of tea. Okay, what happens next? So you get the MBBS.
Yeah.
What's
So,
next?
I'm just going to digress from that a little bit because that's something, because I know that I have your students listening to this also.
Sure, yes, yes.
Um, so, when you are in MBBS, usually the branches would divide into medical branches and surgical branches.
Okay.
Places where you operate and places where you don't operate. And the earlier a student can make up their mind about which way they're inclined, the easier it becomes to plan their career.
Okay.
So, for me, very early on, right from my first MBBS, they actually send us to these dissection halls and we have to dissect up dead bodies and stuff. And
Right.
that can be very, very traumatic and gruesome.
Okay.
Okay. But, if you like go with the faith that, this dead body, even though it's a dead body, you are learning on it. And,
Right.
if you have spiritual approach to it, it sort of becomes easier to go through that difficult part. So at that point of time, you know whether you like to cut into things or you don't cut into things. So if you like
Sure.
to cut
Okay.
into things, you can then select your group that you wanted to go through. So for
Okay.
example, I always wanted to become a surgeon. So
Okay.
right from my first MBBS, I knew that my surgical branches had to be, more pit pat. I need to know my anatomy well. I need to know my pathology well. My, surgery, gynec, ENT, opthal, everywhere we cut, that had to be good.
Sure. Okay.
So, this is something that, students need to keep in mind.
Okay.
That
So
the
you
earlier you, yeah,
make that choice. Okay. Make an earlier choice and then sort of pick your subjects and groups
absolutely,
accordingly.
absolutely,
Okay.
absolutely.
How did England happen? At what point did you decide that you needed to sort of leave India and upskill in a foreign country? What was that journey about?
So basically, it purely happened. So I'm really thankful to one of my mother's friends, who is also who is also the mom of a very close friend of mine. She was a lady called as Dr. Mrs. Bhagwat. And around the time I was doing my third MBBS, we'd gone to visit them because her daughter was also doing her exams and I was also doing her exams, and it was gynec, and she was like going to give us a little tips on the gynec parts of the exams and stuff. And they got talking, and my mom basically ended up saying, "Listen, we really are not practicing doctors, so we don't have a hospital to give her and all when she passes out." And that's when Auntie said, she said, "Yeah, but she doesn't have a hospital, but she's excellent at her academics. She doesn't have
Sure.
to, stick to here. She can have wider horizons. Why don't you get her to do this exam in England, which is the MRCOG exam? She says she wants to do gynec, so she can do her basic gynec here, and then she can move on to England." So right before I got into gynec, the concept that I had to go at some point of time, get a qualification over and above what my colleagues here were getting,
Hmm.
um, the seed was planted then.
Okay.
And
So it was
then,
planted at an early
yeah,
age. Okay.
absolutely. Absolutely.
Okay. And how did that help you? Did you feel that the training in the UK really helped? Do you think it was worth it for you to leave India and go abroad to get that sort of specialization?
Absolutely, absolutely, absolutely. I cannot thank that system for whatever it has done for me. It was difficult. It was not easy. But the big difference between the UK and the Indian system is that in UK you are allowed to question the establishment,
Sure.
and they teach you to question the establishment. So
Right.
one of the things that you learn, so you not only grow as a doctor, but you also grow as a person.
Sure.
You are taught to question your own practice. You are taught to audit your own practice, and all those things are not part and parcel of training in India. In
Sure.
India, what did I become? In India, I became an excellent surgeon. So,
Right.
my operating skills, my, technical skills as a doctor came from India, because purely because we have such a big population, that, purely there are like more patients to see, and therefore
Sure.
you tend to see more, and therefore practice makes you perfect.
Sure. It's a
Um,
numbers game, huh? You get the quantum
Absolutely.
of cases you see. Okay.
Absolutely.
Interesting. Okay.
Absolutely. Indian system made me a good doctor.
Sure.
Um, the English system made me a wise doctor.
Wow. Very well framed. Okay.
That was the difference.
Okay. So you sort of go deeper behind the philosophy. You sort
Yes,
of question why we are doing things as opposed to just becoming
absolutely.
good at doing them. Okay.
Absolutely.
Okay, that was beautifully phrased. Okay, so the training in the UK, you're saying imperative, taught you how to sort of question the system, etc. Then you came back to India and you established Cocoon. So I want to understand a little bit about like how you and your sister sort of even came up with the idea. Take us back to the early sort of formative days. And for anyone who's a doctor here or in any sort of specialized field, how do you go from being a specialist to then culminating into a business? That's a big chasm for most people, and you seem to have crossed it very successfully. So I'd love for you to address that part.
So, the entire ethos of Cocoon comes from the fact that we wanted to get ethical and evidence-based practice to India.
Okay.
Basically what would very typically happen in India is that a lot of medical advances, or a lot of medical methods would be put into practice, not quite looking at the hardcore evidence behind it.
Sure.
Whereas, Anagha did a training completely in Ireland. I did my training completely in England. And we were taught to take a look at the evidence behind it. So only if there is an evidence should, something be unleashed on the general population, something of that sort.
Sure. Okay.
We actually saw a gap there. We saw that, we did not have a systematic approach to fertility care here. We also saw that, things like empathy were lacking big time.
Okay.
And so all these things, and we had already trained abroad, and we come from a very, very nationalist family. For us, India is our second love. And so when we came back, even that was there at the back of our mind, that we have to give back to my country.
Sure.
I have gained from it so far.
Sure. Absolutely.
And so
Okay,
that is where the entire idea of Cocoon came through.
Okay, so
And
that I think that sentiment, I also, that resonates completely with me. As Indians, especially Indians who, get trained here in India, then we go get some experience outside. Somewhere our heart still lies with the country.
absolutely.
And when we see so vividly the differences between our system and a foreign system, you just want to bring all of that back to your own country, right? Because you have that foresight into, what you can plug, and I think
Absolutely.
that really is beautiful, and you tried to do that in your capacity.
Absolutely.
Okay, great. I'm going to pick. Go for it.
Sorry, because I've only answered half of your question.
Please,
It wasn't easy. It wasn't easy. Being hardcore doctors and coming back and trying to become a business person was not easy.
Sure.
Because if you want to give a service, you need to look at both part of it. You
Sure.
need to be a good doctor, but you also need to make you need to build up
make a living.
team,
Right.
develop, and you also have to make a living. So
Sure.
that was a huge learning curve for the both of us.
Sure. Okay. I want you to get into some of these challenges, and I have a question here from Ufuf Mirchi, who says, what were some of the challenges you faced, and what are some of the stigmas and myths? Okay, I think this is a really good point. Thank you for asking that question. I mean, doctor, we are Indians. We've grown up in this culture. Could you, and since you sit on the seat every single day, what are some of the stigmas and myths, that in our society have come around infertility? If you could just address that sort of elephant in the room, and sort of debunk the myths for us.
See, stigma and myth, it basically, so let me start by giving you an example. Okay, we are extremely intolerant as a society as far as infertility is concerned. Anytime a couple gets married and doesn't have a child at the end of a year and a half, the entire society starts sidelining them, ostracizing them. They go to a wedding and the woman would not be called, ahead to maybe perform some sort of a part in the ritual or whatever. And these things do happen even today.
Sure.
So, and it doesn't matter what background you come from. So, the learning process started with my staff itself, teaching
Sure.
them empathy, making sure that people have a non-judgmental approach towards dealing with infertile couples.
Okay,
that
so
was
you're
a
saying
big challenge to start with.
one of the myths is that people think, societally, they feel like you get married in a certain amount of years, you should have a child.
Absolutely.
Is there a
Absolutely.
myth around like infertility is the woman's issue and not the man's issue? Like, do you see that? Is that myth?
Absolutely.
Okay.
Absolutely. And this holds true no matter what part of the world you go to.
Oh,
The
really?
woman
Okay.
the woman does end up taking blame for being infertile, because I think psychologically where she carries the baby for 9 months, it is thought to be her problem. And it is not so. If you take a look at all the causes of infertility, about 40% of causes are of female origin, about 40% of causes are of male origin, and 20% causes are either combined or unexplained, where your general normal investigations haven't really given you an explanation for it. So therefore, 50% of causes of infertility are purely of male origin.
Oh, really? Okay.
And it's quite difficult to get that across to a guy. So being a female consultant out there, sitting in an infertility, sitting in like a fertility OPD and telling the guy, listen, sir, I think the problem that we have is with the sperm. Men tend to take it very personally. Because for them to be able to father a child, is a question, not being able to father a child becomes a question on their masculinity.
Sure, of course.
And
Okay,
until that patriarchal attitude continues,
right.
the society looking at infertility as a woman's problem is going to continue happening. But
Okay,
having said that, I've been back in India now since 2012, 2013. And I see slowly a change occurring in the society.
okay,
These days, I see more husbands who are willing to be a part of the treatment, who are willing to understand and act towards getting the to the end point of having a baby along with their wife together.
okay. This is great. I actually had no idea. So you're saying 50% of the cases are attributed to the man and 50% to the woman, and then obviously there's a
Yes,
gray area which we still don't have answers to.
yes.
Okay, doctor, is there a myth about age? Could you debunk that myth for us? What is this? Is it 20? Like it seems to be like 40 is the new 20. Is it 30? Tell us about this whole age factor because this comes up in
Okay.
conversation all the time.
Okay, so age factor, as far as the woman is concerned and as far as the man is concerned, works a little differently.
Okay,
So for a woman, every woman is destined to have menopause.
okay.
And about 10 years before she actually achieved her menopause, her fertility potential has actually gone to being near zero. So if a woman
Oh,
got so if a woman got menopause at 53 years of age, at around 43, 44, her eggs were near zero.
I see.
And because every woman needs to attain menopause at some point of time, there is a biological clock in her body that makes sure that she loses eggs every month.
Okay,
So even as a baby in her mom's womb, she has already started losing her eggs.
okay,
Okay, so
okay,
therefore, when your grandma said try and get your first baby a little earlier, she wasn't wrong.
okay, fine. Okay,
Worryingly so, Asian women lose their eggs faster than Caucasians do.
okay.
And that is where the big worry in our society comes through. So when I
I see.
sat in England, if I had a 38-year-old come in and say, Doctor, want to have a baby, she's, white, English, completely different food, lifestyle and stuff, I'm more likely to get a good quality and good amount of eggs from her
Sure,
than a 33-year-old Asian woman in India today.
sure. Okay, I see.
So, that is how the age works with women. So,
Okay,
ideally speaking, so your best chances of having a baby are between the ages of 24 and say 30, 32.
okay.
You still have decent chances of getting a baby between, say, 32 to say 36. 35 downwards, we see a rapid decline of the egg content and the egg quality.
Okay, great. I'm glad you addressed this because a lot of millennials, a lot of sort of working professionals like me, we sort of debunk this myth in our heads, right? We're just saying, oh, of course, age is just a number. 40 is the new 20. But clearly, from what you're seeing from a practical perspective, it's a reality. Your age is your reality, and it does matter if
Absolutely.
you want to have babies.
Absolutely. No, but there are ways and means around it.
Okay,
So, typically, girls are no longer subservient to anybody today. Girls are
right.
going out in the world and achieving a lot more than what probably boys of our generation are.
Sure,
Look at you, for instance, and look at our entire group.
sure.
Those women are really, really high achievers. Now,
Right,
if a
right.
woman wants to prioritize her career over a family, but she
Mm-hmm.
wants a family at some point of time, she
Yeah.
has the option of freezing her eggs open.
Okay,
Okay?
great. Can you address this? Because I had this question from Ed M. Gursahani who says, could you talk a
Okay.
little bit about egg freezing and how it works? So please go
Yes,
ahead.
of course. So basically, when you're younger, you go through stimulation of the ovaries like we would do for an IVF cycle. So the lady basically comes in, gets her investigations done. We do a sonography to make sure that the ovaries are like in a decent state. We give her some injections to try and coax her ovaries to form more eggs. And
Okay.
once that happens, what then we do is that we wait till the follicles mature with the eggs inside them, and she goes through a small procedure called as the egg collection procedure.
Okay.
Now, at egg collection procedure, we empty the ovaries and collect all the eggs that we get, and
Okay.
these eggs can now be frozen, and we freeze
Frozen.
them and we
Okay.
keep them at 196 degrees centigrade minus. in
Wow.
liquid nitrogen, and
Okay.
I could leave them at that stage forever. Okay, so
There's no
at
shelf
that
life to
point,
these eggs.
there is no shelf life to these eggs. And
Okay.
even if this lady now at her age of 37 comes and says, Doctor, I've like, done my career, I'm financially stable now, found the right guy, I now want to have the babies. All I have to do is thaw her eggs, get the husband to give me some sperm, create the babies in my lab, and transfer the babies, and she goes ahead and has a baby. And
Oh, wow.
when I do this, even at her age of 37, I have got babies that are essentially of, I have got eggs essentially of a 26, 25, 27-year-old.
That
And
egg
therefore the
quality is
quality,
still, I see.
absolutely, the quality of the embryo is then what I would have naturally got at that age, but I now have the benefit of getting it at the age of 37, 38.
I see. Okay. So for anyone looking to like sort of, especially for a lot of our students who are very career focused, if they're thinking of having children later on in their lives, ideal if they sort of just their eggs mid to late
Absolutely.
20s, and then you can sort of use them.
Absolutely.
As long as
24
you're,
to 28, 24 to 28 is an ideal time to actively think about egg storage.
okay,
By the time you're 34, you should hopefully have stored some eggs.
I see. Okay, great.
The
Okay, very
earlier the better.
helpful. Earlier the better. Okay, because the quality
Yeah,
of the egg is better. Okay.
absolutely.
I'm going to read out some compliments for you, Dr. Sonali says, very good and important information shared. Thank you, Sonali. Comments, it's great to see how much our society has progressed if people are opting for fertility treatments. Absolutely, Sanjeev. Thank you. Uh, Comment here from Ufmirchi says, what you're doing is amazing, helping parents and thousands of families. Great, thank you for that. I have another compliment here. You look so happy-go-lucky. I don't believe you are a doctor. Absolutely. Okay, great. Thank you all for those interactions and your comments. Yeah, follow-up question here about the sperm's age. So for the female, you said you just sort of freeze it lifelong.
Absolutely. Okay, so with the sperm also, the male age does make a difference.
Okay.
So older fathers tend to, partners of older fathers tend to have more miscarriages. Partners of older fathers tend to have babies who will develop problems like diabetes when these babies grow up.
Mhm.
Older fathers also tend to pass on more genetically abnormal DNA to their offsprings. The reason being, as men age, the DNA in their sperm develops breakages, which is called as DNA fragmentation.
I
And
see.
therefore, the ideal time for a man to have a baby should be preferably before the age of 45. So men are slightly more luckier. They have like 10 more years in their,
Okay.
in their pocket over what like we have.
Okay.
But in the ideal world, 45 is the right age. And fertility preservation for males is also very important. So, very typically, if a guy develops diabetes earlier on in life, or God forbid, either a guy or a girl develops cancer or something, then egg freezing and sperm freezing also become options for these people.
I see. Okay. Okay. So the sperm freezing is also an option,
Absolutely.
and it works the same way. It's got a lifelong shelf life.
Absolutely. Once you
Okay.
freeze them, you actually put them in suspended animation.
Okay.
And therefore, you can just revive them at like a later date with a good quality thawing protocol in place.
Okay. So, and would you recommend, again, I think we have a question here from Beena asking, is there a difference in girls' age and boys' age? So for the sperm freezing also, would you say that the late 20s also for men, or is it okay to extend
Earlier the better again. Earlier the better.
earlier the better? Okay. Okay, great. Beena, I hope that answered your question. I'm going to pick up this question here from Sonali, who says, are there any complications of having pregnancy after 35 years, even if the eggs have been frozen earlier?
Okay, so as you grow older, your pregnancy does tend to be more complicated because with age, your tendency of developing diabetes has naturally increased. With age, your tendency of developing blood pressure has naturally increased. Over and above that, there is the stress of carrying a baby for 9 months. So
Sure.
older mothers generally tend to have preeclampsia, blood pressure problems, diabetes in pregnancy problems. They also tend to have more incidences of thyroid problems during pregnancy.
Sure.
Labors tend to be longer. They're more
Okay.
likely to end up with a cesarean section. So yes, age does affect even pregnancy itself and also the mode of delivery.
Okay. Okay. Great. I think we've got a pretty good insight into age. Doctor, I know on the website, there are lots of other methods. You guys have other treatments. If you could talk a little bit about some other treatments, and I'd love for you to touch a little bit upon surrogacy. I know you have done cases because we've spoken about this. So a little bit about surrogacy, how that works, and your thoughts on it.
Okay, so basically, so when a couple decides to have a baby, depending on what medically what they're faced with, the problems that they're faced with, treatment can be as simple as lifestyle modification, make sure that their micronutrient and their vitamin levels are brought up to scratch, and then just supporting them through trying at the right time. So
Okay.
trying to make advise them to try at the time when the egg is mature and about to rupture and things like that. And
Okay.
quite a few people do fall pregnant at that stage.
So non-invasive,
Um,
just sort of
yeah,
consulting and
absolutely.
sometimes. Okay.
Absolutely. Where you do have sperm problems, there are treatments like IUI which are available. So, the sperm is less in quantity, or the swimming capacity of the sperm is less. It's not too less, but it's borderline less. Then what
Sure.
we would normally do is we would coax the woman's ovary with some tablets, maybe some injections, to try and grow a few extra eggs than what she would normally do. Because normally a woman will grow one egg per month in her
Sure.
cycle. So we try
Hmm.
and coax it to go up to say two or three or maybe four,
Per
and
cycle.
per cycle. And at the time when it's going to rupture, we take the sperm, we wash it. The procedure is called as sperm prep, and we pick up the best quality, normal form, best swimming sperms from that. We concentrate it down to a very tiny amount, maybe like 0.3 ml or something, and it is directly put inside the womb of the woman. So
Okay.
now the sperm has to travel less distance,
I
can meet
see.
with the egg earlier on, and therefore chances of pregnancy increase.
Okay.
But when there are major problems, so a couple has tried for more than 3 years and things have not worked, or previous treatments have been a failure, or the sperm is not of a great quality at all, so you've got a really bad counts or poor motility, or the egg quality or the egg number is really bad, then these couples will end up having IVF. So
I
IVF
see.
is necessarily, as I said, for egg freezing, coaxing the ovary to form follicles, collecting the eggs outside, getting the sperm to mix with the egg outside in our lab to form a baby, and then
Okay.
transferring this baby back into the womb. So
I
these
see.
are the
Okay.
basic treatments that are available. But
Okay.
we
So
also
just
have,
to be clear, the IUI, the baby is still formed within the mother's womb, etc.
yes,
And the IVF, the baby is formed externally and
babies
then
formed
sort of fertilized.
externally.
I see.
Yeah.
Okay, great.
Absolutely. So basically, these are the basic treatments that a fertility doctor will deal with.
Okay,
But then we
sure.
have got higher end treatments. So we have higher end things, that interventions that we would do in our lab. So for example, when the baby doesn't stick, and we believe that it's because the covering of the woman's egg is very hard. We can do something called as laser hatching of the embryo. So we thin out the covering of the embryo so that it is able to stick easily.
Okay.
Or then we've got things like Pixie, which allows us to pick up a sperm which has the capacity of sticking to an egg. Because if the sperm doesn't stick to an egg, it is not going to be able to form a baby. So in
Okay, great.
Pixie, we can actually pick up a specific sperm.
Okay.
And then we have genetic treatments at the other end. So people who keep getting recurrent miscarriages, sometimes the embryos are not genetically stable. So
Sure.
we have facilities where we can collect one cell from that embryo which is forming, send it off for genetic testing, and if it ends up testing for abnormal karyotype, abnormal number of chromosomes and DNA, we then avoid transferring that embryo. So
Okay.
therefore, only healthy embryos can be transferred, and therefore our success rate goes up.
Okay. All right. Great. So IVF, IUI, sort of more stable sort of treatments, and then a series of options of more advanced treatments.
Yes.
Um, can we touch a little bit upon surrogacy? And why in India do they sort of outlaw surrogacy, and then they say, okay, now it's actually legal? Like, what is the the ethical issue around another woman carrying the baby, and where do you stand, on this debate?
Okay. As a doctor and as a fertility doctor, I believe that it is every couple's right to become parents. And there are certain couples who genuinely have a problem carrying their own child. So, some poor woman who has had multiple operations on her womb because she had fibroids, or who has had her womb removed because of cancer, she's never going to be able to carry her own child. Or
Sure.
somebody who had TB as a child, and the TB has completely destroyed the cavity of her womb. This
Sure.
woman is not going to be able to carry her child, and she deserves to have the right to have a child, because even your Charter of Human Rights, Article 12, says that you have a right to propagate.
Sure.
Okay, and therefore, as a doctor, when I have a treatment with which I can help my patients, I would love to do it.
Okay.
Now, coming to where we stand with surrogacy. So, surrogacy is basically when somebody's pregnancy, somebody's embryo is carried by some other woman for 9 months. She delivers and she hands the baby to the couple. Okay. Now, this can be done altruistically. Somebody can do it right from, from the goodness of their heart. Or like in India, we could have commercial surrogacy. Now, the
Sure.
problem comes is when you have commercial surrogacy, the problem is how do you make sure that the rights of the surrogate and the rights of the couple are safeguarded? So unless you have a legal framework in which you fit your treatments, it is very difficult to go ahead and do things.
Sure.
Because, there are ethical guidelines, but there also need to be legal guidelines. So for example, suppose if we have a foreigner couple. So now in India, surrogacy for foreigners has been completely banned. I
Okay.
can do surrogacy for an Indian couple who is staying in India on Indian passport. I cannot do surrogacy for a couple who comes from abroad on a foreign passport, or even if they have got their OCI cards.
Is
Because
there a legal structure around the costs for this sort of treatment? Like, is there a minimum mandatory amount that you have to sort of pay the person who carries the baby or anything like that?
unfortunately, at the present times, no. And that is where
Okay.
the worry of extortion of the surrogate during commercial surrogacy comes from. And that is the
I see.
reason why our government went about trying to frame the surrogacy law in the first place. So now
I see.
surrogacy
Okay.
law is going to take a look at who is allowed to do surrogacy, who is allowed to become a surrogate. Um, we do not know yet whether they are going to be allowing continuation of, commercial surrogacy in India or not. But even
Okay.
if they do, they would have a strict framework about minimum amount to be paid, minimum care to be
I
given.
see.
For example, when we go ahead with surrogacy, we do make sure that we have a full medical cover in place for that lady who's going to become a surrogate for one of my patients. We
I
work with
see.
agencies that are like registered with the government ICMR, and we also have all checks in place. We have facilities for emergency medical access for these surrogates. So as long as
Okay.
so most of the centers are now going to have to make these available before they would be given
Sure.
license to conduct surrogacy treatments. So it is
Okay.
still a bill. It sort of still needs to go through both the houses and it needs to be ratified. But hopefully we will have some really nice framework in place to make it easy.
Okay, great. I think that's very enlightening, and it helps us get a sense of, what the dilemma really is, and why is it such a big deal? Okay, thank you for sharing your views on that. I'm going to pick up a question here. This has come up actually. A couple of people have asked about costs. If you could, throw some light on how expensive are the various treatments you spoke about, just to get a sense of like, I want a baby, but how much is this going to set me back?
Yeah, absolutely. So, the costs are actually quite variable.
Hmm.
Even if you take the IVF treatment itself, the cost varies. The reason being the injections that I have to use. So, multiple factors there, but let us take injections as an example. Okay, so I can have a lady who is, say, Mrs. ABC, who's going to need injections at, say, the dose of 200 for 8 days.
Sure.
And Mrs. XYZ will need the injections at a dose of, say, 450 for 15 days.
Sure.
And therefore, there is a wide variation in the costs of the injections that go in itself. The injections, obviously, the cost of that is regulated by the pharma industry and whatever their MRPs are.
Right.
And at an average, the injections that a person needs during IVF can range anywhere between, say 65 to a lakh, 65,000 to a lakh.
Okay.
And therefore, IVF by itself does tend to be a costlier treatment. Again, there
Okay.
are costs that like, the lab is going to incur.
So
So
doctor,
the
just
average
end
cost,
to end, yeah, average cost.
yeah, so average cost across the spectrum, across India is probably around 1.8.
Okay.
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 Uh, Depending upon the stimulation that you use, it can be done in like a cheaper way.
Okay.
Um,
So you're saying
what
anywhere from like at the lower end, it could be, let's say, a lakh or so, and it could go up to what price? Like, in your
it
experience.
could go up to, so again, so it is like, buying your like standard generic jeans, whereas walking into a Levi's and buying a jeans there. Okay,
Sure.
so it is the same jeans probably made in the same factory, but you will end up paying a premium in Levi's. So it
Sure.
also makes a difference where you're having your treatment.
Of course. Okay. Okay. So, but
So,
you're saying broadly in a lakh or a lakh and a half to two, the treatment
lakh
is
and a half
feasible.
to two, any decent IVF center that
Right.
uses good quality materials, that
Sure.
uses good quality injectables. So injectables also, you have the pure ones and you have the impure ones. So people who use urinary, injections are able to give the treatment at a much lower cost.
Okay.
People who use highly purified injections or recombinant injections, which are the purest form, will tend to have slightly higher costs. But then the
Okay.
purer form of injection that you use, the better quality of egg that you get, and the better the success of getting a baby.
Of course. Okay. So it'll depend
So,
on the equipment,
yeah,
the doctor you go to, the clinic, the
absolutely,
experience.
absolutely,
Okay. Many factors,
absolutely.
but roughly, for the people who ask the question, sh- doc
1.5 to 1.5 to 2 will be with a decent IVF center, depending upon the amount of injections that you need.
okay, great. Thank you for addressing that. Doctor, if we could just address some general, lifestyle tips you have for people who want to have a baby. We have a question from Beena saying, is it true that you should give up on alcohol when you want to conceive? Is this a myth or reality? And what do you recommend? I
Okay,
mean,
so okay. So, if I take a look at my medical books, okay, smoking is a complete no-no. You cannot be
okay,
smoking either tobacco or any of the recreational drugs that people smoke. You cannot be doing any of that if you're trying for a baby. Absolutely a
okay.
no.
So smoking
With
is a
alcohol,
no. Okay,
yeah, absolutely. When it comes to alcohol, obviously, I've worked in England, and social drinking is the norm. It's like the lifestyle there. So therefore, if I like sit in England, I would normally say, okay, you could have maybe like, one small glass of wine a week or something, and
sure.
that is like all that you would be allowed. But in India, again, the answer tends to be a no. And the reason for that is that Indians, as I explained to you, tend to have a poorer fertility potential as compared to Caucasians or Africans. So we
Sure.
tend to do poorly as far as our like, so even though we are a billion plus,
Right.
people who have found it difficult to fall pregnant, the infertile population that we have tends to
Sure.
do poorly as compared to the infertile population abroad.
I see.
So, so you're like, a standard African patient or your standard white Caucasian patient would give you better outcomes than your standard Asian patient will.
Okay. So you're
And
saying in
therefore,
general, even in India, given the fertility rates and the circumstances, best avoid
absolutely
it.
no. Best avoid until. So normally what I tell the husband is that show me that your wife is pregnant with a heartbeat for the baby that she's carrying in her womb, and then you can go and celebrate with a glass of wine if you want.
Oh, wow. Okay. So for both men and
Yeah,
women, it's the same
absolutely.
rules apply. No alcohol for both
Absolutely.
and no smoking for both.
Absolutely.
Okay.
Absolutely.
Okay. I love how this is sort of equalizing the gender constructs we have in our mind, right? Like typically you see like, I see this with all my friends, the woman is pregnant, the guy is out partying and, or they're
Oh,
trying to, the couple is
absolutely.
trying to conceive and okay, great. I'm
And
glad
that
you,
is, that is like so unfair, because even she wants to party.
of
And
course.
it is not a responsibility. It is a two-team job.
Sure. Okay, great. I'm glad you touched upon this. Picking up a quick question here from Merkaba. Oh, great. Approximately how expensive is the storage of sperms and eggs? And how much of does it cost to sort of preserve the eggs thereafter? This is a great question. So the
Okay, so
actual process and
obviously,
then the
yeah.
sort of storage process.
Okay, so the actual process of egg collection and egg freezing is slightly lesser than the cost of your IVF, because here we are not forming the babies.
Sure.
Okay, So we are just collecting the eggs and we are freezing. So so basically the lab costs of creating an embryo and transferring the embryo and all that doesn't happen. So most centers will give you egg collection and egg freezing at a slightly lower rate at what they would give you IVF.
So we're talking about
One
egg, sperm interchangeably, right? It's the same.
No, so I'm now talking only eggs because that tends to
I
be a
got
little costlier because the
okay.
lady has to have injection. She has to go through the process of collecting eggs, and then the eggs need to be, so the eggs are very, very fragile. They need to be stored on these special straws. And freezing eggs is also a very, very complex procedure. So you need excellent expertise in your lab to do that. Touch wood,
I
I
see.
mean, we have like Preeti at our end who's like who's like a wizard with this. So,
Okay. So
yeah.
with eggs is more complicated.
Yes,
If it's
absolutely.
sperm, it's cheaper.
Yeah. So it is cheaper with sperm, and we also request that the guy gives more than one sample.
Okay.
Okay. And for the guy, he doesn't need to take any injections. There is no operation to collect those sperm. He
Sure.
just comes in, he just produces his sample on site. The sample
Okay.
goes to our lab for like a quick check, and then we process it, and then it gets frozen. So it is
Okay.
much easier.
So roughly, what would be the cost of the sperm collection and then the storage?
Hardly anything. Equal to maybe one meal at a five-star.
So I mean, does that mean like less than around 10,000 rupees?
Yeah, absolutely.
Okay. And the
Absolutely.
and the and the maintenance cost of the bank, like or whatever you guys
Uh,
call the.
yeah. So we don't have a bank. We are actually an IVF clinic. Because when you say bank, it has a completely different meaning to it, and I'll like come to that in a second.
Okay.
The maintenance cost is generally a very small amount per year,
Okay.
but 10 or 20,000 max, depending on how many samples and how they have been stored. So,
Okay.
sometimes the samples have to be split stored, sometimes they have to be, double washed, and that like depends from patient to patient.
Okay. Okay, great. Merkaba, I hope that answered your question. Doctor, going back to a little bit about the career, in itself, for people who are, considering medicine or, a super specialization such as yours, what advice would you give to them? What is, you've been through this, right? You've been through the journey. As you said yourself, it comes across as glamorous. People think, you hit 35 or so and you've made it. Uh, Tell us, from your practical experience, what advice do you have for someone young who would like to see themselves in your footsteps? What's the reality of this career?
Okay. It is a great job to do. The satisfaction of being able to sit with a couple and tell them, okay, the test is positive, and I'm going to scan and take a look at your baby or babies, depending on how many you've conceived, maybe in 10 days' time. That is probably the happiest thing that we do in our job.
Sure.
Okay. And, the
So, so
satisfaction
high
is
high
absolutely
customer
amazing.
satisfaction, of course.
Absolutely. Absolutely.
Okay.
But behind that satisfaction is years and years and years of hard work. IVF is not something that you learn overnight. IVF is not something that you go and do a course for 15 days and come back and start your own center and do it. You might have money, you might go abroad, do like a 1 month course and come back. IVF is not about it. IVF
Right.
is a lot about, getting your basics in place. IVF is a lot about, so basically, if you ask me, yes, I've been an IVF consultant. I've been doing IVF, say like for the last 12, 13 years now. But I believe that with each patient that I see, I'm still learning today. There are times when I see a patient and I actually say to her, there is this bit about your problem that I'm going to go and read the latest research about and come back, and then we deal with it.
Wow. Okay.
So basically, people just see the glamour of it. People just see that, IVF consultants have a great lifestyle. So for example, if, I decide to meet you tomorrow for a cup of coffee, I can just shut shop at 4 o'clock, and I can be with you by 6.
Sure.
That's because IVF has no emergencies. We have no emergencies in my field, and
Sure.
I can
Okay.
do that. But to be able to get here, okay, I have studied my socks off. And
Hmm.
I've actually, so even now when we get difficult patients, it's like me and Anaka on the phone with each other, or me with like my rest of my doctors. So we do have these telephone consults with each other even now. And
Okay.
and we work hard even now. So
Okay.
the glamour is great, but that work needs to be put in. Like a short course, and only because you've got money, you go and you set up your lab. You do that, you are not well prepared, you will not get results. Word of mouth will not bring you your next patients, and that is
Okay.
what people need to realize. So yes, it's a
Hmm.
great field, but please be prepared to put in the hard work that needs to go with it.
Okay. So high customer satisfaction, of course, very rewarding at the soul level, but clearly you have put in, and you and your sister both have put in years and
Absolutely.
years and years of dedication.
Absolutely.
Um, Okay. Do you want to touch a little bit upon your expansion plan? So, you obviously you've mastered the art of, producing the baby, and now you guys are sort of, scaling up the venture. I know you have six clinics already in India, expanding to three or four more by the end of this year. You talked about a little bit of expansion into Uganda and Africa. What's on your mind? How are you guys planning this sort of expansion, and why?
The why is the easy part. How is the difficult part?
Okay.
Why? Purely because we know that the clinical excellence that we give in Cocoon is
Hmm.
something that I believe should be made available on a wider scale. We now have very robust protocols in place. We have clinical protocols. We have got lab SOPs. We actually have our SOP booklets in place.
Sure.
We have our KPIs in place. We keep auditing ourselves. We have some weekly audits. We have some monthly audits. We have some 6 monthly audits, and we keep improving on our work as we go along. And our success speaks for itself. So
Sure.
we have this little ceremony that we do for anybody who gets pregnant and we're discharging. So very typically a couple with us gets pregnant, and we do their first pregnancy scan. We see the baby, we see the heartbeat, everything is fine. And because we don't do deliveries, we normally send them back to the doctor that sent the patient to us in the first place, or we send
Sure.
the patient to a doctor of her choice. But before she goes, we have this little cake cutting ceremonies with confetti and stuff at times and stuff. And We do that almost twice or thrice a week. So
Wow.
whatever
Okay.
we are doing, we are obviously doing a good job of it.
Sure.
And if I'm able to do it in my current 5 or 6 centers, I should be able to give that to people of India at other places too. And that
Sure.
is where the need to expand came from. You know,
Sure.
obviously, the satisfaction from running a decent business comes in it.
Sure.
But the satisfaction as a doctor of being able to bring my expertise out to a wider forum really is what ticks both me and Anagha off into wanting to do this. How are
Sure.
we doing it? It's difficult. It's not easy. It's really not easy. So the company has got certain centers which are company-owned, company-operated COCO models. We have FOCO models. We've got franchise-owned, company-operated models into our expansion. We also have franchise-owned, franchise-operated models. We are looking more for the FOFO type of model because now that the expansions are happening farther away from home base, that makes more sense. So, remote
Okay.
control of operations with us giving all sorts of, technical backup makes more sense than being hands-on with operations at that end. And it is working quite decently well with our current FOFOs that we have in place. So that's
Sure.
the way that we're looking to go ahead.
Okay. So clearly you see the need for this, and you have the expertise. So this is a great combination of, serving a market need, and you and your sister and your
Need is
entire team.
absolutely there. Need is
Need is
absolutely
absolutely there.
there.
Absolutely.
The Ernst Young report and the subsequent reports that came through, followed on with different agencies, estimate a 29 million infertile couples in India today.
Wow.
So if
Wow.
you have
Okay.
29 million infertile couples in India today, our social structure is such that most of them are not coming to ask for help.
Sure.
Okay,
It's
they're
still a
still.
yeah, right. It's still a taboo, right?
Absolutely. So,
Sure.
that taboo is keeping them away. The ones
Sure.
that are coming for help, they don't have enough good quality centers offering full range of services.
Sure.
So, for example, you go to some place, they might do only IVF, they wouldn't have facilities for ICSI, they won't have
Sure. Sure.
facilities for freezing.
Sure. Okay, great. Doctor, the session has been extremely insightful. Abel says, really insightful session. Bhakti says, brilliant session, very insightful. Merkaba, this has been one amazing and real life informative session, helpful to the core. Okay, great. I'm going to let Doctor go. She's been super generous with her time. And Doctor, I've learned so many things, and you've really helped debunk so many myths. Your journey reeks of passion and commitment. And I'm very thankful for people like you who help others reach their dreams. And you take home a life. I mean, it's just for me, doctors always, I tell people, they're like God, on earth. And really talking to you has been a conversation for me with God itself. So this has been fabulous. Thank you so much. Really touched my soul and my heart. Thank you, Doctor.
Thank
I'm
you
going to
so
allow
much,
you.
Vibha. It was absolutely fantastic being on your forum. Thoroughly enjoyed my evening.
Thank you. Thank you,
Take care,
Doctor.
and please keep doing the fantastic work that you do. I do attend your evenings quite often. And the wide range of experts that you bring on is absolutely amazing.
Thank you, Doctor. All thanks to friends
Bye.
like you and the support. Thank you so much.